All right, hey there. So your pain is coming from the lumbar spine down kind of in the SI and then going down the leg and down into your foot. So this is a pretty classic sciatic symptoms. The lumbar spine houses the nerves, L3, 4, and 5, and S1 that go down the leg and into the foot. If you want to research dermatomal patterns, you can kind of see which nerve root is potentially being impinged, which is causing symptoms, because each nerve, like L3, has a different distribution pattern of symptoms than L4 and L5. So what you want to do when the pain is coming from the low back, you mentioned that it hurts if you go into extension. That's because the nerve roots are closing down. It feels better if you lean forward, which it opens up the joints, or if you bring your knees up, which also opens up the joints, because if you see the arch here, if I bring my knees up, it's gonna flatten out a bit. So it's relieving for you to flatten out the spine, which when you flatten out the spine, it kind of opens up the foramen or the facet joints of the lumbar spine, which reduces the stress on the nerve or opens up the nerve root, the foramen, versus if you're going into extension, that's closing down the nerve root. So one of the things that can cause an increase in lordosis or a closing down of those facet joints is tight hip flexors. And we get this from sitting all day long, or sometimes even working out if we're doing anything where we're like doing a lower ab workout where we're lifting our legs or doing scissor, lower abdominal, we'll tighten up the hip flexors. So to stretch the hip flexors, you want to go into a gentle lunge, and the front leg is bent, the back leg is straight, both knees or legs are pointing directly forward. And to get the stretch, you want to bend that knee forward. What you don't want to do is have this knee come above the toe, because that's going to compromise the knee. And what you also don't want to do is open up the pelvis or create that arch in your low back. To get a true hip flexor stretch, these muscles through here, you want to tuck your pelvis under, and you will automatically feel that stretch through here. But what you don't want to do is arch back or to anterior pelvic tilt, stick your tush out essentially. So you want to keep your body upright and tuck your pelvis under, keeping that leg straight. This is gonna really stretch out the hip flexor group, and those hip flexors originate in the lumbar spine. So if those hip flexors are tight, they want to pull your pelvis forward, which is going to aggravate those symptoms and create accelerated wear and tear on the nerves and muscles and the spine and the discs and everything. So hopefully that helps. You can also make sure that when you're standing and doing all your other exercises, even like a squat, you don't want to arch your back and stick your butt out. You want to keep a flat back, right? But you don't want to have that accelerated or accentuated arch. So a flat back is good. You don't want a rounded back, that's really bad. A flat back is good when you're doing other exercises as well.